Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Good morning. Welcome to another episode of We Talk Health. My name is Susie Tucker. I work in the cardiac rehab and teach our heart count specifically for our patients who are undergoing any type of cardiac surgery. With me today, I have our case manager, Miranda. She works closely with these patients, preparing them for discharge. We're going to speak to Miranda. And Miranda, tell us a little bit about your piece and your role and your involvement from the diagnosis, I guess you could say, all the way up until discharge.
Okay. Well, my name is Miranda. I'm a case manager that covers CVICU and the step-down unit. My goal is to prepare each patient that's going to have cardiac surgery, prepare them to go home and make sure they have everything they need when it is time for discharge. So I hopefully start before surgery during pre-op discharge planning, where I will meet with each patient and speak with them just to kind of gain an idea of what their activity level was prior to coming to have their surgery. At that time, we just kind of discuss the expectations, what our goals are, and see if the patient has that plan already in place and if there's any hurdles that we need to jump over. Once the patient does come to the hospital for their surgery, I will follow them from the time they get into CVICU until they are discharged. I will usually follow up with that patient just to make sure they're progressing as hoped, as planned, and see if that plan needs to be updated or if that plan works.
Thank you, Miranda. I know that's always important. We do start talking about the discharge at the admission piece. So it's truly always important to make sure that we go ahead and plan for that transition from home to hospital. With us today, we also have Bonna. She's a nurse practitioner for our CV surgeons, our cardiovascular surgeons. And Bonna's going to speak to us about the inpatient stay as well. Also, we have with us Hannah Fish. Hannah is our nursing discharge advocate from A2, our step-down unit at West Tennessee Healthcare as well. So, Bonna, if you could, can you just talk to us a little bit from the CV surgeon standpoint and what our patients can expect from the hospital stay?
Yeah, so many people are able to go home. They have the luxury of going home before open heart surgery, which is a shock to many people. And so we like to set the expectation, letting them know what their hospital stay will look like. And so we ask that they just kind of make a plan. They get a support person. They have somebody who will be with them, taking this journey with them. If they know they're going to be in the hospital, they can anticipate to be there for the better part of a week. And they can make plans. They can bring some items that feel more like home. Maybe they have a pillow they like or something that just reminds them of home. They can go home and rest and be comfortable instead of having to stay at the hospital up until their surgery. They can get somebody to take care of their pets and anticipate the need for food and provisions when they get home. And leading up to their hospital stay, all of our patients do get this information from our nurse Kathy at the office, and they'll show up the day of surgery at 5 a.m. They will not have anything to eat or drink after midnight. They'll go to our admissions desk at the front, and they will direct them from there. And after surgery, they can expect to be in the cardiovascular intensive care unit for at least a night or two. They'll have a heart monitor, they'll have tubes, wires, other devices. So it's a little intimidating. So that's something the families can prepare for, certainly. The very day after surgery, we have a physical therapist who will get them up out of bed. And if they're stable, they're going to walk them out to that floor and the step down to the ICU. That's where Hannah kind of takes over. And so, Hannah, if you would just kind of speak to us about what patients can anticipate after they get out of our ICU.
Sure. So I'm Hannah. I'm the discharge advocate on A2, which is the step-down unit to the ICU. So when you come out to the floor, you can expect an average stay of approximately 3 to 5 days. You'll have physical therapy every day, nurses and patient care techs that'll be taking care of you each day. They'll both be doing rounds every hour to check on you to make sure you have everything that you need. You'll be expected to be up to the chair with each meal and stay there for as long as you possibly can because the goal is for you to get out of the bed. And then when it comes time for your discharge, on that day, all of your doctors, if they're agreeants into discharge, will work on your discharge orders. And after they have worked on your discharge orders, I will come to your bedside with your discharge paperwork, and we will be able to review all of the instructions that you'll need at the day of discharge. We want you to have your family there as well so that multiple people can hear what you can and cannot do whenever you go home. We'll make sure that you have everything that you need, go over all of your instructions on what you can and cannot do, follow-up appointments, what to call your doctor for, and then any kind of new medications you may have. We'll go over your complete list of medications.
One of the things that our patients often ask about, Hannah, in our heart camp is the pain and what's to be expected and how their pain's going to be managed post-operatively. Can you speak to just a little bit about that from the nursing aspect?
Sure. So whenever the patients come out to the floor, we can expect that all patients will have some type of pain as you've just had the open heart surgery. So as your nurses are rounding on you each hour and any time in between, if you are hurting, please let them know so that we can get you something to help with that pain. But also knowing that you will be sore as an expectation and that the pain medicine is not going to totally relieve your pain completely. They will ask you how much pain you're having on a scale of 0 to 10, where that might be located, and then treat that as needed. If you do have medications that are not effective, we'll be able to communicate with your doctors and nurse practitioners to try to get you something better to relieve your pain.
Yes, pain management's very important. Bonna, can you speak to that piece as well?
Yeah, absolutely. A lot of people don't. The amount of pain they're in doesn't always cross their mind. And as we know, people experience pain differently. So we just like to set that expectation to anticipate the discomfort that is associated with open heart surgery, and for our patients to know that they can ask for pain medicine, and we want them to be as comfortable as possible, but to also know that that's not always going to happen, and we just have to fight through that pain together and as a team.
Miranda, if we could go back to the discharge piece again, can you speak to that just so our patients know the different options, maybe pathways that are available for the transition home?
Yes. During pre-op discharge planning, we usually speak about what the plan will be at discharge. However, we know that things may change. So home health could be an option, inpatient rehab, skilled nursing facilities, outpatient physical therapy, all of those could be options, just depending on where you're at when it's time for discharge and how you're progressing through the admission. Also on discharge planning, the discharge planning team makes rounds every Wednesday and Friday, and our team includes myself, the case manager, our social worker, Hannah, our discharge advocate, the clinical manager of A2, the step-down unit. Our dietitian is usually present, and also a representative with inpatient rehab, just to see if that person would benefit for inpatient rehab at discharge. Our physical therapy assistant is always present during those rounds, so she's always there to let us know how the patient is progressing and advises on whether that patient would be safe going home with family, home health, or if inpatient rehab would be beneficial.
So as y'all can see, it takes a massive team of people and effort and teamwork to get our patients through this process of open heart surgery, from the time we know that the patient needs surgery until they're discharged home, and even beyond that, from nurses to doctors to the patient care techs to respiratory therapists, nurse practitioners, physical therapy, our social services team, our dietitians, and even our pharmacists. They all work closely together to make sure our patients have what they need and are well taken care of. And so we just wanted to kind of highlight the awesome group of people we have taking care of our patients throughout this process of open heart surgery.
Thank you for listening to another episode of We Talk Health. If you have any questions at all, please, we would like to address those on the air. You can reference those questions to wetalkhealthpodcast at gmail.com. Again, please send any questions you may have to wetalkhealthpodcast at gmail.com.